Susan G. Komen Foundation invests hundreds of millions of dollars into studies and clinical trials, all with one goal, beating breast cancer. And joining me now to talk about those efforts, Nancy Brinker, the founder of Susan G. Komen, and Dr. George Sledge, Chief Scientific Advisory at Komen. Thank you so much for coming in, both of you. Appreciate it. How is cancer research becoming more personalized now?
Well, it's becoming more personalized, and you hear a lot about precision medicine, and that's where Dr. Sledge, who's chair of our scientific advisory board, head of oncology at Stanford, has so much to add. He's helped us so much with the cadre of scientists we have and that we fund in every year in the program.
But there's something called biomarks now, right, where it gets really specific.
Indeed. So we can take a piece of the DNA from a human cancer, we can grind it up, we can analyze it, and we can tell every single mutation in that cancer. Knowing that mutation, knowing what is wrong with the cancer's basic instruction manual allows us to intervene, allows us to come up with therapies that are specific for a particular patient's cancer.
And do you recommend, based on, we've seen celebrities like Angelina Jolie do this, preventative treatments like double mastectomy. Do you recommend a measure that some might consider drastic but yet effective at the same time? What is your take on that?
Well, we do it for very specific patients. If a woman has a mutation in BRCA1 or BRCA2 genes, part of the DNA fix-it kit that the body has, that predisposes them to a very high lifetime risk of breast cancer, perhaps 80% risk of breast cancer, 40% risk of ovarian cancer. So for that woman, it's a reasonable thing to consider. For the general population, no.
Back in October, the American Cancer Society released new guidelines, essentially putting into question at what point women should get mammograms. What is your take on that? A lot of people thought that was confusing.
Well, it is confusing. It's confusing because we have several different guidelines across the country. The U.S. Preventive Health Services Task Force has one guideline starting at age 50. ACS says 45. Other organizations say age 40. The real problem, though, is that in the United States, about a third of women never get a mammogram. This is due to problems with access. It's due to problems with concerns over the radiation of the mammography. But it's a real loss in terms of life saved.
And Nancy, you want to add to that?
Yeah, and also the guidelines from ACS recommended lessening the need or not at all for clinical breast exam, and this is how many women have no other intervention available to them. So when you go to areas that are more and more rural, where there are more and more low-resource people, this may be the only way that a lesion could be detected, and by then it's pretty advanced too.
So rather err on the side of caution?
Oh, I'd always rather err on the side of caution, allowing the patient to make a decision with her physician. With his or her physician, and figure out what to do going forward. But to further confuse the public, in my opinion, is wrong, dangerous, and not really going to take us forward. We have to let people learn things and help educate them and let them make good decisions for themselves.
Especially at a time where there's so many advances being made in different arenas, all for the same goal, beating breast cancer. And it can be done.
Right.
You're confident we can eradicate this thing?
Oh, well, we can, and we are making huge gains in making this a more manageable disease every day. Since 1990, I think we've driven the death rate down, or rather increased survival rate, I think is a better way to say it, 34%. And this is, impressive, and still we're not where we want to be. A lot of patients are living longer lives with advanced breast cancer, not always the best quality of life, so we're addressing those issues too. But we work very hard every day in labs like Dr. Sledge's and others throughout the world to bring people the best advances we can in breast cancer.
We're going to continue to help you do that. WPBF 25, of course, a proud sponsor of the Susan G. Komen Palm Beach Fundraising Gala, the Perfect Pink Party, as they call it. And we're going to be having that event coming up in January,
yes,
right?
Yes, that's right. That's right. Yeah, first weekend of January.
Fantastic. And, great time. A lot of people are down here during that time of year.
Exactly. And then it's followed closely by our Race for the Cure, which is a community event bringing the entire community together. And it's all preceded by lighting the bridges between West and Palm Beach pink. So when that happens, it's Breast Cancer Month in the Palm Beaches.
And it's a beautiful way to display and get the message across. Nancy Brinker, thank you so much for coming by. Appreciate it.
Dr.
Sledge, thank you. You flew all the way from California to be here this morning.
Thank you. Delighted to be here.
Thank you very much. Stephanie, we'll send it over to you.